So welcome from Ambulance Victoria, Danielle Saxton.
Hi, thank you for the introduction. I'll just try to share my screen. Okay, is that working all right?
It certainly is.
Great, all right. So ordinarily in pre-COVID times, I would ask if everybody noticed where the nearest AED or defibrillator is. Now in a conference centre, it's likely to be in the foyer, quite well signposted. If someone was to collapse in the conference centre, it's very likely that a system would kick into place very quickly. Someone's likely to call 000. I would be very confident that a handful of people would be confident to start CPR, and someone would grab that defibrillator and bring it back into the person who's collapsed. As mentioned, I've been a paramedic for 19 years and I've developed a real interest in out-of-hospital cardiac arrest, which is the pinnacle of ambulance response. It's when we go to somebody who isn't breathing and their heart isn't beating and we try very hard to bring them back to life. So I've spent the last 3 years managing projects which encourage the community and specifically bystander response to out-of-hospital cardiac arrest with Ambulance Victoria and through the Heart Foundation. I'm very proud to work on the Good Sam project, which is a system that can help ensure there is bystander attendance and participation during a cardiac arrest. So I outline the normal response in a public or crowded place. Good Sam works to send the crowd to someone who's collapsed, such as at home or in a less crowded place where there might not be a big group of willing participants to help out. Now I want to clarify, I'm speaking about out-of-hospital cardiac arrest. So these are people who aren't in hospital. They may be at work, picking up the shopping, doing the school run, or at home. It can happen to anyone, anytime, and often without warning. And it's not just an old person problem. In Victoria, around 40% are between 15 and 60 years old. The incidence in Victoria is about 18 per day, so it is likely it's something you'll come across. So why is the community so important in this? I'll give you some out-of-hospital cardiac arrest statistics. Now, Ambulance Victoria has a world-class research and evaluation department. The amount of statistics we have are mind-blowing to me. I'll run through a couple of key ones, but this slide alone could take up the whole presentation, if not the show. Now, what I'm showing you is the chain of survival, and anyone with medical or first responder experience would have seen this. It's been around since the 80s. Now, this is everything that has to happen for someone to survive an out-of-hospital cardiac arrest. So as I said, there's about 6,500 cardiac arrests out of hospital every year in Victoria. About 75% during normal times occur in private residences. Now, one of the key stats is that for every minute a patient doesn't get CPR or a defibrillator or AED isn't used, survival falls by 10% per minute. So the first part of the chain is early recognition. So this is somebody knowing there's a problem and calling 000, and that starts the whole process in place. That happens correctly about 95% of the time in Victoria. As I said, calling 000 is the next point. Now, when we get to the 000 call taker, based on the information they're given, about 85% of the time they can correctly pick that there is a cardiac arrest in occurrence. Here's where survival starts to be determined. Early CPR dramatically increases survival rates. So this is CPR before the ambulance gets there. About 62% of witnessed cardiac arrest, so someone actually watches them fall, will have an attempt at CPR made prior to ambulance arriving. Now, this is critical because without that attempt at CPR, the overall survival rate is about 4% in Victoria, and that's a huge difference. Early defibrillation, this is again where survival determinations dramatically soars. Last year, when we last released these stats, about 6% of witnessed cardiac arrests in the community had somebody use a defibrillator on them. So this is a public defibrillator grabbed from the side of the library or the conference wall or the community centre. Now, when this person is first defibrillated by a member of the community, the survival rates can be as high as 68%. So again, that's a massive difference. 7.5 minutes is the average median statewide response time for an ambulance in Victoria for cardiac arrest. And this is when we start doing advanced life support and then get them to the hospital. Now, let me repeat the first stat I gave you, which is that for every minute a patient doesn't get CPR and defibrillation, survival falls by 10%. So what we can see here is the main determination of whether someone survives or not happens to the left-hand side of the red arrow, which is all before the ambulance gets there, which is the community. So this isn't just a Victorian problem. In 2015, there was a meeting of world leaders, researchers and experts. They gathered in Norway as part of the Global Resuscitation Alliance. And the plan was to start this call to action to address the survival rates of cardiac arrest across the globe. So the aim is to bring together research, best practice, and have a united approach to information sharing and improving outcomes. Ambulance Victoria's CEO, Tony Walker, is a very passionate participant and driver in the Global Resuscitation Alliance, and he has allowed AV to continue to drive improvements throughout our system. So the Victorian out-of-hospital cardiac arrest system of care takes into account what we already knew. As I said, we have a world-class research and evaluation centre. We also have a world-class cardiac arrest registry. So for over 20 years, we've been recording our outcomes, looking for improvements, producing really significant research and driving up our own survival rates. We use evidence-based clinical practice guidelines, which change quite often. We have a tiered response framework, so we will send escalating levels of skill to different cases depending on the severity of them. We've moved away from community education and we've moved towards community awareness around cardiac arrest. Now that's to complement the first aid courses which we have across the state, and we've moved towards educating community members on the simple message of call, push, shock, which is call 000, push on the chest and shock with a defibrillator if available. We have dispatcher-assisted telephone CPR. So if somebody calls 000 and doesn't know how to do CPR, our call takers will talk them through how to do it, and we have had lives saved based on this without any other formal training. You mentioned the statewide AED registry. We have over 7,000 AEDs registered across the state. Now, when registered, this means they're available to our 000 call takers. So as well as telling you how to do CPR, they can also tell you where the nearest AED is. And the AED information also flows into our Good Sam community responder app. So this is how the responder app works. We have signed up a group of registered responders and they've downloaded the Good Sam app onto their smartphone. So this is a brief overview of how the system works. A 000 call is received and cardiac arrest is identified. As we said, it's successfully identified about 85% of the time. We then have caller-instructed CPR, which is provided over the phone, and we then have automated systems which will dispatch the ambulance services, and in some areas we also have co-responder programs. So we do send fire services across Victoria to some cases, and they're co-responded with ambulances. Now the Good Sam system is also automatically activated. And how it works is once the system is activated, Good Sam app will notify the 3 closest responders within a set distance. Now the distances set are 400 metres within an urban area or a regional township and 5 kilometres in more regional areas. the responders will receive a notification on their phone, and it's very loud. I'm told that it's quite alarming and it's very hard to ignore, asking if they're available to accept a response. Now, we know people are going about their daily business. They may have children in the car, they've just picked up the shopping, or they're on their way to an important meeting, and they always have the power to accept or reject the alert based on their current situation. Now, if they accept it, we provide further details such as the case location, a little map to the area, and any nearby defibrillators that they might be able to grab on their way past. And if they reject it, it's fine. We just alert the nearest, closest responders within those set areas. The responder then proceeds to the case and provides CPR and defibrillation before the ambulance gets there. So back to the chain of survival, it's all of those things that have to happen for someone to survive an out-of-hospital cardiac arrest. So we're sending the crowd to the location. We don't send Good Sam responders to all cardiac arrests. We've done quite a lot of analysis of our code types, and we actually currently only send to 6 different event types. So these event types, based on a very thorough analysis, have a high accuracy for cardiac arrest. They're very likely to actually be a cardiac arrest. There's a high likelihood that paramedics will attempt resuscitation when they arrive. Situations where they won't attempt resuscitation is if the person's clearly been deceased for a long time. It's not helpful for us to send community responders to those scenes. We also remove any cases that may not minimise exposure to safety issues such as traffic accidents or other high-risk incidents or highly traumatic or stressful events. Of course, recognising that any event can be traumatic and highly stressful. We have a very strong governance system around this. We are sending community responders into private houses. So we have a very strict code of conduct which is available to all responders, and they in fact agree to on signing up. We also have responder selection. So we've escalated this as we've become more comfortable with the program and how it works in Victoria. So we initially rolled out the program just with AV staff. We then scaled up to partner organisations that we had good formal relationships with, then first aid qualified adults. We have now opened it up to anyone who has the skills and knowledge and confidence to provide CPR and use an AED without needing to demonstrate any evidence. Now, we know that people without formal training can save lives. So the challenge for us is to get them there. So we do ID people who apply, so we know who's on our system. We have automated workflows within our system integrated with ESTA and 000. So we will automatically cancel any responses based on some sit reps, so situation reports or code changes. For example, if information is provided back that it's not a cardiac arrest or the patient is deceased or we want to downgrade backup, that will automatically cancel Good Sam responders. We appreciate it's community members going out of their way to assist us, and we don't want to waste their time or expose them to situations we don't need to. Now, we notify responders if Ambulance Victoria crews arrive before they do. Most tend not to attend the case. They accept that there's an ambulance there. The reason we don't cancel is, particularly in remote areas, we know that extra hands-on can make the difference and might assist our paramedics. So we allow responders to continue to the scene, knowing that there's scene control there via our paramedics, and the paramedics will direct them about whether, you know, thank you for attending, but it's fine, you can go, or please help if you're available to. We will also automatically cancel any case if there's a code change, so we know it's not a cardiac arrest anymore. I just skipped forward a bit there. We do exclude some cases, even if we know them to be a genuine cardiac arrest. We don't want to send our Good Sam responders to inappropriate locations, such as a locked facility or a care facility or somewhere where we know that there's scene safety, violence or nuisance issues. So we won't generate alerts to those locations. We also will, if a situation escalates during a case, we will cancel that case and ask the Good Sam responder not to attend. Their safety is our priority, despite the fact we know they may have a good outcome if they attend a cardiac arrest. We provide significant post-event care, again, recognising that we're sending community members to potentially stressful situations. So every responder who accepts a case receives a phone call from us and an offer of ongoing welfare support if required. So we'll ask, are you okay? Do you have any questions? A lot of the time, a really quick hot debrief on what happened and why is enough to help them be able to put away what they've been to. And if not, they have a contact that they can reach out to if they feel like they need a referral or further support. Where an AED is used, we also have capability to retrieve the data. So this will be, it will show us what rhythm the patient was in, perhaps why they had a cardiac arrest, and interventions that happened at the scene, including CPR and defibrillation. So where the patient has survived, we'll provide that to the hospital, which forms a critical part of their ongoing care. And if not, it goes back to our cardiac arrest registry, so we can really understand what's happening and where we can make improvements. We will then recommission the defibrillator and make sure it's ready to go again. COVID-19 implications on Good Sam. We are doing ongoing risk assessments about, particularly in the early stages of the pandemic, where we were all understanding what it meant for our own staff and the community and the wider health system. So our system is currently restricted to Ambulance Victoria operational staff, and that's knowing that we provide them with appropriate PPE, but also the training to support the use of PPE and workplace support afterwards. As we know more about COVID-19 and it's expanding, our knowledge is expanding, we're constantly reviewing how we expand the program back out to meet COVID normal. Overseas experience has shown quite low risks of transmission for COVID in out of hospital cardiac arrest. So we've already started changing some systems, such as our telephone CPR will now advise people just to use hands-only CPR, not to do mouth-to-mouth, but certainly to start CPR. So we're reviewing what Good Sam means at the moment during COVID and COVID normal. Really importantly, it's given us some emergency management planning opportunities, particularly based on international experiences of medical services becoming overwhelmed during COVID. We have spent a significant amount of time putting multiple plans in place to allow us to use Good Sam to expand our responses if required, particularly during extreme workload and surge capacities. So those plans are all now in place should we need them in the future. So it's been a really important opportunity for us. We've also been able to use the Good Sam platform for some just-in-time solutions, such as one of our guidelines around donning and doffing was having somebody watch you do it to make sure you haven't accidentally touched your face during the process. So we had some staff in quite remote areas who didn't have access to other colleagues for that. So we were able to use the Good Sam platform to have a face-to-face video link to provide that support to our remote staff. So it's been really good to really be able to test out how Good Sam works and other ways we can use it. Even if we had to, it's just the planning in place has been really important. Now, this is one of the most important slides, because if you're sitting there wondering if you could join Good Sam as a responder, the answer is absolutely yes, you can. And importantly, if you're sitting there wondering how your organisation can become involved as Good Sam responders in Victoria, I would invite you to contact me because we'd love to provide that support. One of the main challenges we have is having that network of responders spread widely enough across Victoria so we are getting the response to the cardiac arrests. And that's all from me. Thank you for your time.
Well, Danielle, thank you very much. What a great presentation, and what an amazing initiative on Ambulance Victoria's part. So congratulations to you and all the team. So we've got some questions here for you, if that's okay. First one is around identification. So do any of the Good Sam responders, have a hat, shirt, something that identifies who they are when they're banging on the front door?
Look, that has been raised before, and we have been looking into whether we have a sticker. We know one of the features of Good Sam responders is they're carrying a smartphone. So we're even looking at providing a phone cover or something. Mostly what we find is we are sending people into stressful situations. So we do provide some guidance around introducing yourself, and usually the link between we know you've called an ambulance and we want to help is enough to get them through the door. But we are taking that feedback on board, and we're looking at opportunities for that.
Now, in terms of qualifications, just to clarify that again, so does a Good Sam responder need to have a first aid certificate?
No, currently in Victoria, we recommend people have a first aid certificate, but we ask people to join the system if they're confident to provide CPR and to use an AED. But qualifications at the moment is you need to be an adult in Victoria.
Okay, got it. Well, I was a paramedic for 10 years in Victoria. I'm not anymore, but I did say to somebody the other day about joining this, and I said, I haven't got a first aid certificate. I better go and get one. But having heard that from you, as soon as we have the lunch break, I'm getting the Good Sam app. So that'll be good. Now, in terms of insurance, what happens to people if they get there and something happens? We live in this crazy world where people want to sue all the time. So how are people covered?
We provide indemnity insurance for our Good Sam responders. So from the point of activation until the end of the case, we do cover you. Now, we cover for personal injury as well as medical indemnity. Now, Australia has quite good understanding of Good Samaritan laws. So if you are trying to provide assistance to someone, you're generally covered. Where you're not, we do provide insurance.
Excellent. Now, what about equipment? Does Ambulance Victoria provide equipment like gloves or masks or anything, or is it just basically get there and start compressions?
Look, in our code of conduct, we do outline that we recommend PPE generally, such as gloves. That's the standard paramedics will wear, gloves and goggles and a mask. However, there is actually a low risk of disease transmission for hands-only CPR, which is what we're asking to do. So our message is, outside of COVID times, COVID obviously poses its own risks with PPE and its own responsibilities, but we are saying get there, please, hands on the chest, just start compressions. We're not asking for mouth to mouth, and that is what we know will save lives.
Now, I'm just looking at my screen up here, Danielle, and Peter from the CFA says, I live in a small country town with a population of 600, and he is aware of 8 AEDs that are in his town, so that's good. Peter from the CFA said that he is already on the Good Sam system, that when he was in Auckland in New Zealand, his app went off, so that was good. Everybody else is just saying positive things about your presentation. Vicky Lineker from CFA, hi Vicky, said what about AV supplying a tabard for responders, something to think about. Now, in terms of, so is this 24/7? So if you've got your phone next to your bed at 3 a.m. in the morning, you can be expected that your Good Sam app might start blaring at you.
Absolutely. Now, you are able to silence it if you want to, or have sleep times where it won't go off. We do find, given the context, that you are being woken because someone very close to you is in cardiac arrest. We find most responders are very keen to answer the call any time of the day and night. And it's interesting, the point Peter raised before, we did have a someone visiting from New Zealand in the last couple of years who signed up to Good Sam over in New Zealand and attended a cardiac arrest of a quite young mother, and it was a successful outcome. And she was just amazed that something she'd signed up on in New Zealand, she'd come across to Victoria, was just waiting for a train. The alarm went off and someone quite close to her was in cardiac arrest. And she was so grateful that she was able to use her skills to save that life. So the stories we hear about this program is amazing. And it's just such a wonderful program to be involved in.
Now, Danielle, just back to the question, I was just thinking about this as I'm sitting here. In terms of equipment, so for somebody who has done a first aid course, or even myself, I mean, I wouldn't mind putting together a little kit of my own that maybe had a bag valve mask and some gloves and whatever in it, so you could get there and, you know, perform effectively. So is that something that AV are happy with? Do you need to review what people might take? What's your thoughts on that?
Look, it is outlined in our code of conduct. We do expect that people will respond within the scope of their training. So we do have some quite highly qualified medical professionals. In fact, there's a quite publicised cardiologist who's responded to a few Good Sam cases. Now, the level of care that he may provide under his own registration and skills is obviously quite different to you know, that's a first aider or someone who's confident to provide CPR will do. What we know is, regardless of that scope, it's the first few minutes and the CPR and the defibrillation that really makes the difference. But I'd always encourage someone to put together their own little pack of, you know, gloves and a mask and whatever else they're comfortable with, but also to know where the defibrillators are around them if you don't carry one yourself.
Yep, okay. Now, Danielle, John Chatfield from the iGEM office says, or asks, do you have any stats on how often, I guess this depends where you live, but generally how often an individual has been responded or does get responded? Yeah,
look, it does depend where you are. We have some who live in central Melbourne who are responded quite often. In fact, we get to know their names on our daily reports. And then in some regional areas, some people may have been waiting for their first response for a couple of years. So it really does depend where you are, and also that the alert happens within that range of where you are. But what I would say is, you know, whether you're getting responded often or once every 2 years, it's really likely that if you're available at that time, it will make a big difference to someone's life.